One evening, after returning home from her lectures, Zara developed an extremely high temperature. Also, she had frequent severe chills and sweating intermediately. What was really wrong with her? A few diagnostic tests revealed that Zara was suffering from malaria. And now, she was given all the possible best treatments to recover as quickly as possible. But how did she get infected with malaria in the first place? What could have caused it? And how did the infectious agent take over her body? Let's learn this infectious disease in detail in this video. To begin with, can you tell me what causes malaria? We've always heard mosquito bites are the root cause of malaria. So are mosquitoes responsible for this infection? No. You'd be surprised to know that mosquitoes do not cause malaria, but just spread it. And what do we mean by this? The actual causative agent of malaria is the protozoan called the Plasmodium.
Malaria is a serious and sometimes fatal disease caused by the parasite that commonly infects the certain type of the mosquito which feeds on humans. According to the World Health Organization, malaria is an acute febrile illness caused by the Plasmodium parasite which are spread to people through the bites of infected Anomalous mosquitoes. Malaria is a preventable and curable. Cause of malaria. Malaria can occur if a mosquito infected with the Plasmodium parasite bit. There are 4 kinds of the malaria parasite that can infect human: Plasmodium vivax, P. ovale, P. malarias, and P. falciparum. P. falciparum cause a more severe form of the disease, and those who contract this form of malaria have a higher risk of death. An infected mother can also pass on the disease to her baby at birth.
What is the outlook for people who have malaria? If malaria is not treated properly, it can cause serious health problems and death. It's essential to seek treatment right away if you think you have malaria or have visited an area where it is common. Treatment is much more effective when it's started early. The right medication and correct dose can treat malaria and clear the infection from your body. If you had malaria before, you can get it again if an infected mosquito bites you. Malaria signs and symptoms typically begin within a week after being bitten by an infected mosquito. However, some types of malaria parasite can lie dormant in your body for up to a year. What are the symptoms of malaria? Malaria symptoms usually appear 10 days to 1 month after the person was infected. Symptoms can be mild. Some people don't feel sick for up to a year after the mosquito bite. Parasite can live in the body for several years without causing symptoms. The symptoms of malaria includes fever, flu-like illness, including shaking chills, headache, tiredness, vomiting, diarrhea, abdominal pain, muscle or joint pain, rapid breathing, rapid heart rate, cough, and also malaria may cause anemia and jaundice, means yellow coloring of the skin and eyes because of the loss of red blood cells. How long is malaria recovery? In general, it takes about 2 weeks of treatment to be cured of malaria. Researchers are continuing to develop and study malaria vaccine to prevent infection. Malaria is a serious illness that can get worse very quickly. It can be fatal if not treated quickly. The effects of malaria are usually more severe in babies, young children, pregnant women, older people, you or your child develop symptoms of malaria during or after a visit to an area where the disease is found. Even it has been several weeks, months, or a year after you return from traveling, you must tell the healthcare professionals that you have been in a country with a risk of malaria, including any brief stopovers. To reduce malaria infections, World Health Program distribute preventive drugs and insecticide-treated bed nets to protect people from mosquito bites. The World Health Organization has recommended a malaria vaccine for use in children who live in countries with high numbers of malaria cases. How is malaria treated? Treatment for malaria should start as soon as possible. To treat malaria, your provider will prescribe drugs to kill the malaria parasites. Some parasites are resistant to malaria drugs. The type of medication and length of treatment depend on which parasite is causing your symptoms. Anti-malaria drugs include